Thank you, Karen, for coming and talking to me today. I'm so excited to have you. We have talked like virtually before, but never actually met in person. So everybody watching, this is
Mhm.
Karen Trainor. She is a dermatopathologist. So she's an anatomic pathologist that has special training in like the derm side of pathology, which is really cool because you can actually do more training and like more specialization within pathology that I don't even know all that much about. So I'm excited to hear what you've done because I don't even know what you do to get that special training. So yeah, so thank you. And I think everyone's gonna love hearing what you've done and how you've gotten to where you're going or where you are. So what started, I guess let's take it back to the beginning, like as far as you think is interesting to go, but we have the people watching this will probably be a big variety of people. So from vet students to GPs that are interested in path to path
Yeah.
residents, so where at what point did you decide that you wanted to go into pathology? Like that's always a big question that people ask.
Oh, yes. It was sort of a gradual process. I really enjoyed my path lectures, the first part of vet school, and then the second summer, the summer after my second year, I signed up for a couple of jobs. I was looking for summer work. The first one I was going to do like maybe six or first half of the summer at New England Primate Research Center in their comparative pathology lab. And then I was going to do the second half of the summer with USDA um, down in the Maryland area. So I'd set that up. Everything was all squared away. And I showed up for my summer internship at the Primate Research Center. And I had such a great time there. And I got to work on this fascinating project about SIV, which is simian immunodeficiency virus in macaques. And it was such a great project. And then there was this retired pathologist, and he would come in and do rounds with the residents that were in training at the department there. And one day, none of the residents were able to show up. They were all busy doing necropsies, called into stuff. And so I was available. So they said, oh, well, Dr. So-and-so is here. Do you want to go join him? He had his box of slides. So I sat with him across the scope and we went through slides together. And
Wow.
he started going through and he put down a slide and he's like, just start describing what you see. And I was like, oh my gosh, I don't know anything. I'm not a resident. I can't do this. And so I just started describing. And he's like, what do the cells look like? Are they polygonal, round? And I'm like, okay, round. He's like, okay, that's great. It reminded me so much of that video you posted, the TikTok of the guy, doing the pathology.
Hmm.
That's exactly what he was like. So he sat down, he talked me through, and he's like, so what do you think the diagnosis is? And I was, running through all my differentials for round cell tumors, and then it just popped into my head. I was like, it's not lymphoma, it's not a mast cell tumor, not a plasmacytoma. What is this? And I was like, TVT. And his face lit up, and he was just like, yes. And I was like, oh
Wow.
my God, I can't believe it. And so then they told me, the project was going really well, and I was having such a good time and really learning so much. And I kept doing those rounds with him. And my boss, who was a boarded pathologist and had a PhD, and I was like, oh wow, um,
Mhm.
that's a lot of training. And he pulled me into his office, and he's like, Karen, you have got to be a pathologist. You've got to do this. And I was like, I didn't know what I was going to do in veterinary medicine yet. And I was like, huh, okay, I'm going to give this some thought. And so I was like, okay, that's it. I'm going to do it. I'm going to do pathology. And then I started, getting more serious
Into it.
about it. Because,
Yeah.
yeah, they were so kind and like generous with their knowledge and took the time to,
Mhm.
show me stuff. And it was the first time I felt like I could do something or like, something clicked.
Yeah, that's really cool. I love that because I did an externship my 4th year. Well, yeah, I guess it was my 4th year at Vanderbilt University with a lab animal pathologist. So I got a little bit of a exposure about what that specific area of pathology is like. And it was really cool. I mean, that's obviously not what I do now or what you do now, but it was just neat to kind of see what they do. And that's awesome that he was so encouraging of
Mm.
you, because I think that makes such a big difference, what
It
your
really,
confidence in pursuing, like having somebody tell you like, you can do this, and you like, I can see the potential in you to go this direction. So that's really cool.
and that was, I think, the first time in my life anyone had ever said anything like that to me. And I was
Yeah.
like, wow. And
Yeah.
so it got it so inspiring. And I thought, gosh, I want to be like that someday. And I wanted to
Yeah.
be encouraging of others. And I've met so many people through pathology that were very encouraging and supportive and
Mhm.
such wonderful mentors. And so I
Yeah.
thought, these are my people.
Yeah, I love that, because yeah, it's just the people that it trickles down, right? I mean, when you have great mentors, I feel like you just kind of end up being, by that example, a good mentor yourself, or at least somewhere in the realm of that, because it's just seeing that example and realizing what an effect it can have on you. So you did that, and so then you decided that you wanted to go into path,
Mhm.
and then what did you do?
So I knew I wanted to go into pathology, and I ended up trying to set up some pathology externships, but then pathologists were leaving all different places. I went to like Angel Memorial, and then there were no pathologists there anymore.
Where are all the pathologists?
I don't know that something was happening around, I don't remember, I guess that was 2005 or so, 2006. But then I thought, you know what? I interviewed tons of pathologists and residents, and I talked to them, and a fair number of them had some clinical experience before they went into anatomic pathology, because anatomic path is one of the very few residencies you can go directly into straight from vet
Hmm.
school. And I thought about it, and I was like, well, if I go down this path of pathology, which I only just decided to do like a year or two ago, that means I would never get to practice clinical medicine. And I thought after vet school, I really want that experience of doing some clinical practice outside of being a student. So I did a rotating internship in small animal medicine in Rochester, and it was uh, amazing and grueling.
That's usually my response too. There's like a pause. I'm out of it far.
Yeah,
I'm far out of it enough to be able to appreciate the experience. That
yeah.
might not have been what I was saying at the time. Yeah.
Right, right. Like in the moment, like it was the hardest year probably of
Yeah.
my entire life. But looking back on it, it was also probably the most phenomenal as far as how much I learned, seeing the cases. And one thing that I found when I was talking to all those pathologists and residents, especially the ones that had the clinical experience, they seemed to say how much that clinical experience meant to them when they
Hmm.
try and tie their pathology findings, either histopath or cytology, with that clinical correlation. They said
Hmm.
it really added a different value and perspective and made them a stronger pathologist for having that clinical experience. So I thought, okay, I'll do a 1 year internship because then they'll know I'll leave after a year. And I'll decide then if I want to either go into practice or do pathology. And it confirmed for me I wanted to do pathology, and I chose a place that had a necropsy room. And they actually told me that if I ever had a case where I couldn't get a gross diagnosis on a necropsy, that they would pay for the histopath. And there was this really awesome pathologist they worked with, and he was in upstate New York. And I would call him sometimes when we were waiting on results. We've got to take this, maybe a dog had a splenectomy and they needed to know the results of the splenic, biopsy. So I would call him sometimes at all hours. They're like, you got to call the pathologist. And I was like, okay, I'll do that. And so I'd call him up and I talked to him on the phone. And he was a super nice guy too. I never actually met him, but he told me he worked out of his home in a cabin in upstate New York in the Adirondacks. And I was like, I want your life. I was
Yeah.
like, 110-hour weeks or working from home in a
Yeah.
cabin.
Yeah. Yeah.
So I was intrigued. And so I thought maybe I'll look into this diagnostic pathology because my understanding was, there's tox path, academia, or diagnostics, and maybe some lab animal research type. And so the diagnostics seemed more and more appealing because I really liked the clinical stuff. And it was like a high, like when you solve that case and you figure it
Mhm.
out, or you look at a cytology smear, or you look at a blood smear, and it's like, oh, I see, all the features of immune mediated hemolytic anemia or something.
Hmm.
We got our
Yeah.
diagnosis.
Yeah. The
I just
answer's right there. It's
love
awesome.
that feeling, and I
Yeah.
love just solving that. And so I thought that's what I think I want to do. So
Yeah. Yeah. So from there, you obviously went into residency. So you applied, got in
I
right away, got
I
one right
applied
away.
up to a bunch of places. I did not get my first choice. But it works out that I think the universe had something different in mind. So
Hmm. Doesn't it always?
it does, because I ended up at Texas A&M, and for pathology at the time, and I don't know if it's still the case, but most residencies for pathology are not through the match.
Hmm. Yeah.
And there was sort of like a gentleman's agreement amongst people that they would only make offers after a certain date. So you wouldn't start getting offers from different places at different times. And so I ended up accepting the offer from A&M, and it was phenomenal. I wanted a change. I'd lived in New York State my whole life. I'd grown up there, went to college, vet school, internship, all in New York. And then, so I wanted something different, and Texas was very different. And I
Hmm.
ended up meeting my husband while I was there, but there was a lot of equine cases on the pathology service. And what really sold me was the residency director there told me, we have all the infectious diseases here. We
Oh,
have it all. And
sold.
I was like, sign me up,
Yeah.
sold. So
Yeah. Because that's a big
I
thing
was
with
like,
different residents, having to, when you are a resident, you're studying for boards. If you don't get exposure to
yes,
a lot of infectious stuff, like that's what you kind of have to seek out or look in the book, but that's not always, we know how that's not always enough, to feel
right.
confident. So
And
that's
that's such
cool.
an excellent point, because that was part of what factored into the decision was I wanted a program that would really that had a good boards pass rate, and that would be well rounded and would help fill in the gaps that I felt like I was weak in. I was starting to feel more comfortable with the small animal side of things. After the internship, I'd done a mixed track in vet school, because I thought that would be the most balanced way to keep all my options open. But then I thought, I really don't have much large animal experience. And they said they had a lot of,
I
cattle
bet.
and equine stuff. And then the infectious diseases, we didn't get a whole lot in upstate New York. So I thought, yeah, I want to see that, and I want to get more
Some
exposure.
hepatozoan, little
Yes,
hepatozoan here
yes,
and there. That's one I've only had
yes.
one case of, because I did all my
Uh,
cases from the Midwest and the South, but not like the Texas South. But yeah, jealous of that.
I think my first month, I think even my very first week on necropsy at my residency, we had a case that came in. The dog had this like extreme hypercalcemia that no one could figure out what was going on. It had this like weird diarrhea, and basically the entire dog was mineralized. When I did the necropsy, I took out the stomach, and I could bang the stomach on the metal table,
Oh,
and you could hear it clang.
oh
And so
no.
it was like the most remarkable case. And then it turned out to be heterobilharzia. And
Oh
everyone was
wow.
like, what? And
Yeah.
they'd done a fecal and didn't see it, because I guess it depends if you do like a sugar versus a saline. And
Yeah.
they didn't do like whichever one, I guess it's a saline you're supposed to do, or a direct smear. And so they'd missed it. And so then we're like, and then one of the ClinPath resident mates, I think her dog ended up having it like a year later. And she's like, I remembered that case because I used that like for like rounds
Yeah.
or something. She's like, I remember that case and the dog having like some weird diarrhea and like some hypercalcemia, or like they couldn't figure out. So she's like, I did a direct smear and I found heterobarzi. I was like, oh
Good.
my
Well,
gosh.
good. And
Like,
that feels good too, because you were able to teach, like you saved a life. Like here we are as pathologists talking about banging dog stomachs on the table, but the end goal is not to be weird and, do
it's
things like that.
to help
It's
cat.
to help. Yeah, it's to help learn what happened to the animal, not only for the closure of that
Right.
owner, but also for people to learn from those
Exactly.
cases so that they
Right.
can treat animals going forward. So that's, yeah, that's
Yes.
cool. That's a cool, like, total example of that.
That's how I see it, because I saw during my internship, I would do the necropsies, and I did them for my cases, my attendings and intern mates, because a lot of times it would bring closure. Sometimes
Hmm.
people weren't sure, did I make the right decision? did I do the right thing? And a lot of times I could say, yep, there was, hemangiosarcoma in the brain, primary hemangiosarcoma in the brain, like
Yeah.
what can you do about that? You know, and so sometimes it can just bring closure. And I
Mhm.
also feel that sometimes, perhaps the loss of that animal can help others. It
Mhm.
can help our entire field, and it can help perhaps diagnose or catch things sooner, or help us to find new ways to make a diagnosis. And it can help save another life. And so that's how I often explain it to people when I would ask them, permission, if they seem receptive to it. May we examine or submit a biopsy or do a cosmetic necropsy, because if we, especially if we couldn't get a pre antemortem diagnosis, like, can
Mhm.
we learn from this going forward and save another life?
Yeah.
And a lot of these people were supportive of that, and actually kind of relieved to know that maybe their animal didn't die in vain, or that something could be learned from it. So
Yeah, that's a really good, and I'm glad that you touched on that, because for the people that are listening that are, pet owners, I mean, a lot of us are pet owners ourselves and have
yeah,
experienced pet loss, I'm sure before. I know my own cat died suddenly when he was 3, and it was in vet school. It's been a long time. Rest in peace, dude. He was a sweet boy. But he just dropped dead in my kitchen. I'm like, what in the world is that? And had a necropsy done, and he had occult heart disease. And there was comfort in that, knowing that
yeah,
what had happened, just needing to know that. And some people don't want to know, and that's okay. But I think
oh,
there's a big hesitate, and I love that you had the clinical experience and you saying like how you approached it with owners, because I mean, I have a lot of friends that are clinicians, and my husband is a clinician, and those conversations can be uncomfortable, or like you can perceive it as being uncomfortable, so you don't even ever ask because you don't want people to be offended or weirded out. It's just they actually may want that, and be relieved by that suggestion, and there's a way to approach it.
yeah. You kind of had to, I guess, read the room and sort of get a
Yeah.
sense. Some people just wanted to know. They wanted that answer. They wanted that closure,
Hmm.
and to know that they did everything possible, and it was something that's just untreatable, or that's
Yeah.
beyond what we can do, and they can be at peace with that. And so
Hmm.
a lot of times, people were very receptive and very grateful, because we had some, really great cases that then we all learned from, going forward, and some that they'll stay with me forever. I really learned from those animals, and I'm very grateful to their families,
Yeah.
uh, for granting us that permission.
Yeah. Yeah. And so, I mean, I think that that probably answers a big part of the question of, what do you like about being a pathologist? And I'm going to come back because I want to know how your residency was and stuff, but just being a pathologist, that's probably a big, I think people kind of look at pathologists in general, but especially you anatomics. I think people are like, what in the world are those weirdos doing? And why would you do that? Why would you go into that? And here's the reasons why. I mean, it's a mystery that's fun to solve, but we're also not insensitive to the fact that,
Yeah,
there's a pet owner and a pet on the other side of it. And even though we can have, you know, uh, fun with our diagnoses and get excited about them, we totally understand the difference, in the impact of how it is on the for the family. So that's a good point to bring up and remember. So you went to Texas A&M, and you
mhm.
did the combo program, right? You did PhD also, or no? Okay, I didn't do
No.
a PhD either. Yeah, I know. Nope.
I knew I
No,
wasn't
not a loaded
cut
question
out
because I
for that.
didn't either.
I have complete and utter respect for
For
those that
sure.
do. I just know that I'd done a master's before vet school,
Mm,
and so I had a taste of like the research and writing and publishing, and I was just like, it took me until 2 years into vet school to finish that master's degree and that thesis. So I was like, I don't think I'm cut out to do that, especially not concurrently with a
no.
residency. So I was like, I'm gonna set that aside.
Yeah. Yeah. And I think especially if you kind of have an idea that you want to go into diagnostics afterwards. And I think, there's this whether it's right or wrong, I think it's probably based on the residency questionnaire stuff. I think it probably is correct because people cited this, but Having that PhD is nice for obviously research positions for academia, and is not always necessary. Not to say it's not valuable, but it's not always necessary in diagnostics to get the job. So yeah, so I'm with you. I have total respect for them for doing that, because it is hard. And yeah.
Yes, and it adds so much to the field.
Hmm.
I just thought maybe there's other ways that I can contribute without
Yeah.
personally taking that on. So I kind of had a sense by that point I really wanted to focus on diagnostics.
Yeah, yeah, yeah. So take us a little bit through your residency, because I assume it was fairly similar to mine, but what was your kind of day-to-day life like? I know that changes a lot and changes from year to year, but do you have like a general sort of idea of what you did as a resident?
It was a very structured residency, which I really liked. So we had, quite a lot of necropsy rotations, especially early on in first year. And I saw a ton of cases, and it was just a great learning experience. So I loved being on the necropsy floor. And then we would also rotate through and read surgical biopsies. And then we had a lot of different rounds. We had AFIP Wednesday slide rounds, although we did them, I think, on Fridays. And then we had gross rounds from on Friday afternoons. All the cases from necropsy, they'd present all the gross lesions, and everyone would go through. Anyone from the vet school could come. So I really loved gross rounds. And then we also had gross quiz. Fridays were like big on rounds, like all day, pretty much. And I love gross quiz. Although our mentor that led the gross quiz, he's very famous for saying absolutely not when you were wrong. So I got a lot of those.
When you got it wrong, he would say that? Oh,
Yeah,
nice.
he'd say absolutely, and you're like, oh, did I get it? And he's like, not, and you're like,
Oh, cool.
it motivated me because every once in a while, like for the more senior residents, he'd say, absolutely, you got it. And everyone's like, oh, someday I want that. That's what I'm working for.
Yeah.
So we had gross rounds, and then sometimes I drop in and visit cytology rounds once in a while if I had time. But otherwise, after necropsy, then you would go trim in your tissues that you collected, and you'd help teach the students how to perform a necropsy and collect different types of samples for different types of conditions that you're concerned about or the clinicians want to rule in or out. And then you'd wait and get your slides back, usually like the next day or so, and then you'd read out your slides and review them with your attending. So it was very structured, and I kept very busy with that. And then we also had classes. So ours was actually, I guess I should reframe what I said. I didn't do a combined residency with a PhD. It was combined with like a non-thesis master's.
Yeah,
So
same.
we did some coursework, and you get a master's, but there was no thesis involved, no research. And then every year we would present a case at like CL Davis, like we had these regional conference, and we were encouraged to present a case for that and publish an article during residency, like as a project. And so it was pretty structured. And so I would take, Gen Path, we did that, first for, like the systemic pathology, learning all the different organ systems, like normal and then all the abnormal. And it just takes a long time to go through that and practice. And
And read
we
all
also
the
did, yeah, and TVMDL was the Texas Vet Med Diagnostic Lab, which is basically across the street from the pathology department at Texas A&M, and they were the state diagnostic lab. And they would do rounds for us as well. And that was phenomenal because they had a different caseload than what we see at the university, which is like secondary, tertiary type, all like the weird, unusual, bizarre, complicated stuff. TVMDL, those cases were more like the everyday lumps and bumps, lipomas, histiocytomas, papillomas, fibroid nexal dysplasia, that kind of stuff that you see like all the time. And that was tremendously valuable because that was more reflective of like day-to-day diagnostic pathology. And so I really, really love that. And sometimes I'd go over and and read cases with them or sit across the scope or ask them, hey, do you have anything interesting? And they would put together like, okay, I've got some cases here, go take a look at these, come back, tell me what you think. And so it was just like getting to play pathologist. And so it
Yeah.
was a lot of fun.
Yeah. You're bringing me back to the residency days. Makes me all verklempt.
Yeah,
How I used to,
I know.
I love my residency.
Like
I mean,
yeah.
we're in different areas, but the whole thing is very similar. So yeah.
Yeah. So
Yeah.
I mean, there's certainly challenges along the way, and like I really struggle to learn the material. Like it's just not the way my brain works. It takes like a long time for it to really sink in.
Same.
So it was, you know, just about persistence, just keep showing up, just keep going around, and eventually like things just start to click and you're like, ah, okay, now I recognize that, or now
Yeah.
I can come up with some good differentials.
Yeah.
And I feel like yeah, it really all just comes together over time if you stick with it.
Yeah. And so because board studying is the big beast that we
Yeah.
all have to go through. And so for anybody watching who isn't familiar with boards, uh, it's it's changed a little bit over the years, but how it is now. Did you guys have a part 1 and a part 2, like the Gen Path section? Okay. So
It was all
that's because I thought that they started that right when I was taking them. But Gen Path was chunked off of it, and it was taken like somewhere in second year. It wasn't even that long ago, and I can't remember. But and then
block it out.
I know, and that was all the Gen Path stuff, so general pathology, and then the more specific for Clin Path, and for you guys specific for anatomic path was at the end. And that's a big challenge for anybody going into pathology, because you have to, the residency is one thing, and then passing the board exam is what really is kind of the ultimate goal.
Yeah.
So yeah. So did you have any time off or anything to study for that, or?
They would reduce our amount of time that we were on necropsy and on surgical, so we would have a bit more free time. And I had taken most of my coursework early on in the first couple of years, so I had a bit more free time towards the end. I honestly can't remember what amount of time or how that worked out, but
Right.
they did understand. They gave you some time, but I started studying probably halfway through my second year. Just writing out index cards. I filled like an entire box full of index cards of all the gross lesions and what the other differentials are and what species they are and what the most likely organ is and what the pattern is, and just went through that box of cards like a zillion times. And like my husband drove me from Texas up to Iowa so I could study the entire way
Yeah.
and go through my flashcards. And so what was really so great about Texas A&M is that they had this binder or these files of documents. After everyone took the board exam, they would like write this manifesto about what their process was to study. And
Nice.
then that was like their legacy to leave to the residents that came behind them. And they're like, okay, if they passed or didn't pass, they would say, okay, these are all the techniques and strategies that I used. This is what worked. This was not the best use of my time. And if I had to do it again, I wouldn't. Or I
That's
did
cool.
all these things, I passed these sections, but not this one. And I really wish I'd focused more on that, but I didn't because I felt either overconfident or it intimidated me. And so like they really like went into it, and I was like, wow, this is so awesome. So I actually made a separate binder of that. And I took over an entire bookcase from like floor, like 6 shelves high. And it was just all board study material. And I had like 5 years worth of journals. I went through like 5 years of AFIP slides, just practicing writing descriptions like over and over and over and over and over, and reading textbooks. And I had, this was right before the recession hit. I was getting all these highlighters because they would give you the office supplies to study for boards because they wanted you to pass. So they
Yes,
kept
free
buying the
office supply.
highlighters. Yeah, and they're like, "Where are all the highlighters going?" And I was like, "I'm studying." Like I highlighted like my entire copy of like Jeb and Kennedy, like 3 volumes, and like all these other books, the Gen Path and
Mhm.
Gavin and like all this stuff, like in the lab animal path book, like the whole thing. It was high. That's how I learn. I have to like physically
Interact with the book.
every other sentence has to be a different color. It's like like the set of 10, and I was like every other sentence. It was like OCD, but that's what
Yeah.
I did.
Yeah. I did something similar. I didn't highlight obsessively, but I didn't really
Never talked about that before.
I'm not knocking it because I'm about to tell you what I did and it's not any better. But yeah, I mean I feel like I'm organized. I've become more organized with age, but I wouldn't consider myself a hyper organized person, but I shouldn't say that you have to be organized to study for boards because I'm sure there's plenty of people who have done just fine with boards doing it their way and there's papers everywhere and stuff. But I just could not. I needed some type of it was just such a huge amount of material that I needed some
Yeah.
kind of system. So I
Mhm.
took all, and for anybody watching that doesn't know about this, you have to read like a lot of textbooks and 5 years worth of articles for your several journals. And when this is something that you love, it's not as painful, but it still is a lot and it can be very painful. And so what I did was I went through all the books that we had to read and I like typed out notes because I can type faster than I can
Oh,
write. And then
wow.
had basically like another textbook that were, that I had, because it was just so many notes and I would type them out and then I got them spiral bound and covered and then I highlighted those, to try to like the goal was before boards time to be able to have like really parse down, like go from the big books to
That's
something a little
fun.
bit smaller to, some sheets to like just so that, when you're on your way to Iowa, which is where the boards used to
That's
be,
a really good strategy.
then yeah, you have like just some quick, like, here's the stuff I still need to remember. But yeah, you just come up with your own method and whatever works for you. But so then you took boards
Yeah.
and then yeah, so that was gone out of the way. And then what'd you do after that? After you left Texas?
Well, I did not leave Texas right
Oh,
away. So that
okay.
was during the height of the recession. That was 2010. So the job market, I think there were 7 jobs listed in anatomic pathology in all of North America. So
What?
people were in a bit of, there was like nothing listed on ACDP. Like
Oh,
everyone had stopped hiring. So I was in a bit of a pickle. So my husband was still doing his PhD. So we I ended up just like out of sheer desperation, like just talking to anyone and everyone that would listen. I was trying to interview, but also by the time I was applying, I still hadn't even taken the boards yet. And at that point, everyone's like, if you're not boarded, we're not even going to look at you. And I was like, okay. Um,
that's a challenge.
so that was a little added pressure.
Mhm.
Yeah. But what ended up working out was there was a professor on campus in the cardiovascular pathology lab, and he did comparative pathology. And he had a backlog of work and was in need of a warm body to help. And I was in need of work. And so I was like, it turned out to be a win-win. And so like all the stars aligned and it all worked out. And so like my residency had granted like a little bit of time in that window, like the end of your residency and when you take your board exam, which I think was like October, I don't even, sometime in the fall. And so right after that, I got my results and I had like a week and it all happened in like a week. And so then I started up there and I learned as much as I possibly could about cardiovascular pathology and like doing, he did all these really cool research projects and was involved in studies like with total artificial hearts and like ventricular assist devices and stuff like that. And I got to, I wasn't scrubbed in, but I got to go into the OR and watch them do the procedure because then afterwards we would do the necropsies to evaluate the devices. And we also examined devices that were explanted from people that ended up getting heart transplants.
Wow.
Because we'd studied them while they were in animals, we got to know all of, the quirks and things that happen with those devices. And we would study them then once they came out of people. So it was a really, really fascinating line of work and subspecialty, to do cardiovascular pathology. And he also did renal pathology, but I was mostly focused on the cardiovascular projects. And so that was really interesting. I think I was there for a couple of years. And then a job opened up at Abaxis Veterinary Reference Labs. They opened up, I think, in like 2011, 2012. And so they were like a brand new diagnostic lab in the Kansas City area. And so my husband had finished his PhD in the meantime and had pretty much finished his postdoc. And so then I applied for the job in Kansas City, and they're like, how soon can you start? And I was like, I'll be there like next week. And so like that happened really fast. And so, I came up here and it was just so beautiful. And it was my dream to do diagnostic work. And so I thought it was really exciting, to get in on like the ground floor of like a new lab. And
Not the basement.
well, yeah, I'd like to be like on the
Yeah.
start of something, big, because they were like, we're going
Yeah.
to change things and we're going to, you know, try and be like a more, local type of service. They ended up being a national lab, but a lot of our clients were from Kansas City and like the local metro area, and some clients out in like Montana and stuff, and like the Dakotas, and I really loved it because compared to like a big diagnostic lab, um, I got to know a lot of the clients because it was like such a small group when I first started, um, and uh, and so it was really fun making those connections with the clients. And like some of them I would know, they're like, oh yeah, I won't be sending any biopsies like the next week or two because I'm getting married and going on my honeymoon. And I'm like, oh, that's so exciting. And so,
That's cool.
it was just fun to get to know people.
That
Yeah.
closely. Yeah, that you
And
can work closely.
yeah, and I got to meet the local dermatologist and dermatology resident, and now she's a fully boarded dermatologist in her own right here. And they would submit some cases, and I met them at like a KCVMA, dinner or something. And then I ended up started bringing cases over to them to go over derm cases together, and we would do derm path rounds. And so, because we ended up starting a derm path service at Abaxis, and I ended up working with a dermatologist. We had a few, but the one I worked with the most was Brian Palmero, and we actually still work together now. And so what we found when we started, at the lab, like the caseload was growing and growing and growing, but unlike other labs, we were not big enough to be able to offer those consultants that can help with cases like with the treatment side of things. But far and away, like we just had so many derm cases, and that part of the caseload just grew like astronomically, like awesome cases like sweet syndrome in a foal. It was so cool. And so people are like, okay, so now I have a diagnosis. What do I do about it? I'm like, I am not your person. I can tell you what it is, but I can't tell you what to do about it.
Yeah.
So we needed help. So we found some dermatologists that were awesome to work with, and so they would read our histopath reports and then give clinical advice. But what was so unique about Abaxis, what I really loved, is that they were like the first to put histology photos or photomicrographs for the cyto folks on the reports. And I personally love that. Some pathologists don't like it because it's an extra step or extra work. I personally loved it because I'm very visual, and I see the picture. I'm like, oh yeah, I remember that case. Okay. All right. Where were we? And then that helps me get right back into where things were. And I also feel like it helps the clinician, especially for the specialists, like the internal medicine specialists, oncology. A lot of them have some degree of familiarity or training with pathology and reading biopsies and cytology themselves. And especially dermatologists, they get a lot of pathology training. So it would help them have more confidence. And one thing I learned from Dr. Palmero is he recommended for the derm path cases is to do like a low mag view and then a high mag view. And because then that would help him have confidence that my interpretation matched with him. So it was like getting a second, like a built-in second opinion. And so it really made our service that much stronger. And we ended up being able to solve a lot of really cool cases because of that good working relationship. between the specialists and then between the clients, because our clients were really wonderful. And I started asking clients to submit, and we almost started demanding that they submit clinical photos before he would interpret them, because he's like, we had to know that we had enough confidence that the samples we received were sufficiently representative of what they were seeing
Mhm.
and that things matched up properly.
Mhm.
So, or
That's
if
so
there's
huge.
like other differential,
Like that's a huge thing in derm
yeah,
to have that clinical correlation.
it,
Like it's a case in all of pathology, but I feel like especially in derm, like it really can make a big difference.
I think that's true. Like for maybe for splenic masses, it's nice to have something like that, or, liver lesion or something. But in some skin masses, certainly I think it can make a difference. But I think for like, especially those like inflammatory conditions in derm path, it's just so super helpful. So we started having people submit the clinical photos, and I love that. Like I just got hooked on it. I was like, I love this. It was like the whole package. It was like full circle, because I've kind of started thinking after doing, the clinical internship and through my residency, it really became clear to me how much of a partnership it
Mhm.
is. It's To me, pathology is a team sport. People would just send off biopsies and think, oh, it just goes off in the mail and I get, this answer comes back and I'm told what it is and I can just move on. But it really is that partnership, using the right technique to collect the samples. I know that's probably something that you deal with a lot with your cytology, educating people how to collect them, how to prepare smears and things like that. And that's so important, because we can only work with what's in front of us, and the same with the history and that signalment and all that information. So, um, it really is a partnership, and we can only give as good as we get. So,
I love that you guys emphasize that so much because like you can emphasize it a little bit and kind of be like, oh, we really need this. But when you're like, no, you really to submit, you need to give us this. It kind of, I mean, I'm sure in a nice way, but it's like you really put a lot of
yeah,
a little bit of a stir.
yeah. I mean, it's hard. I
That's the
mean,
thing.
sometimes you have to say like,
Yeah, I mean, that's the thing though, is that like a lot of, I feel like at least what I've heard from practitioners and a lot of times they don't know, like nobody's really just said, this really does make a difference. And they're feeling insecure about submitting too much information or feeling, stupid or whatever. And it's just like you said, it's a team sport and there needs to be good communication and
yeah,
relationship between any specialist and yourself, but pathologists included, because we just want to help, and but it's hard when you never have that relation, like you never meet each other even on the
mhm,
phone, or just to be able to say, hey, no, this would be helpful for me, because I doubt there are submission people submitting things that are like, I'm going to make this as hard as possible.
right,
Like
right. And that's so true. And that's part of what I love so much about your group is that, and you in particular, is that you're so approachable and friendly and like accessible, and I think people don't necessarily think about pathologists. They're just like more, oh, it's like a lab, and
Mhm.
not so much like a person behind the scope, and that there's a real connection there, and that we want to support you, and that we are there for you. We can help you come up with differentials. We can help you prioritize if biopsy or cytology is most appropriate, or even appropriate at all, or maybe culture or something like that. Maybe do that before you do, a biopsy or something like that. So we can really help a lot. And I think a lot of people don't know that and don't have that interaction. And that's part of why I'm doing what I do now, is I'm just like on a mission to like, let people know that, about how to prepare skin biopsies and how to submit them, how to fill out the forms. I think there used to be, I've met people before and they're like, oh, I was taught not to tell the pathologist anything so as not to bias you.
Yeah.
And I'm like, okay. But then, other people will submit 100 pages of
Yeah.
clinical history.
Yeah.
But I prefer that
Same.
to not getting
Too
anything at
much
all,
is better than
because,
not enough.
you know, yes, yes. And so, because that can make all the difference, like knowing what the breed is or the
Mhm.
location of the lesion, if it's something like metatarsal fistulation of the German Shepherd dog. Like, you'd really want to know that location and that breed, if you're interpreting a sample from that area. So,
Yeah, it makes a big difference.
it's just,
It really does. And that's what I love about what you're doing now too, because you clearly have a teacher's heart, and recognize that people, everybody, like, it's just everybody's trying to do the best we can for
yeah,
the animal. At the end of the day,
yeah.
all of us took the same oath. We're veterinarians too, and that's the
Mhm.
goal at the end of the day, and to help veterinarians feel better and the veterinary team feel better about what they're doing, so that they can
Yeah.
give us the best chance of having like a successful outcome for them. So, and you're
Mhm.
doing a lot of stuff now. So what are you doing? So how did you, so you did, I mean, I know, but you left Abaxis, or are you still with Abaxis?
Well, Abaxis Veterinary Reference Lab does not exist anymore.
Oh, it doesn't? I didn't even know that.
No, in 2015, it was bought
Oh, that's right. I did know that. Yeah. Okay. I'm with you.
by another company and dissolved, and we were laid off. So,
Okay.
um, so that happens though, and I was warned that startup labs, this kind of thing happens. So they said, don't be surprised if and when it does. So I was like, I was fully aware this was a possibility. So most people had left, but my husband and I love Kansas City so much, and he had a job. He was happy here. We wanted to start a family, and just thought it was a really pretty area. And so I thought, well, what if now that there's no pathology lab here, what if I try and start up a service? And I loved that DermPath service so much at Abaxis, and I wanted to somehow recreate that. And so I didn't have the means to do that right off the bat, but I started Innovative Vet Path. And so I started by subcontracting for other labs. I've worked with my classmate, Dave Gardner. He ran Animal Reference Labs, which is now ZN and Zoetis. And then I worked for Marshfield as well. And I was reluctant to put all my eggs in one basket after that experience. So I was like diversifying.
Yeah.
And I worked with Marshfield and Florida Vet Path, who I still work with. And I did some work for Specialty Vet Path. And I also did some consulting work for cardiovascular pathology for some of the clients I'd worked with from before during my fellowship. So, I was doing like a little bit of everything. And then I was just trying to build my confidence and learn how different labs operate and services. And there's all different ways of doing things, and trying to identify the pitfalls and just making note of, because we had so many problems at Abaxis when we first started, like everything that could go wrong went wrong. I mean,
Yeah.
we ended up, fixing stuff, but when you're learning how to do something, and so that was all a great learning experience. And so then I had my daughter, and she's 2 now, but around that time I was starting to step back from reading so much for other places and trying to build up the courage to strike out on my own and build my own client base. And, I just loved having relationships with the clients and really getting to know them, because I feel like that's when I can help them the best. When I know them, they know what I need, they value what a pathologist can bring to the table. And it's phenomenal. And there's nothing else I'd rather do. And I get to do my own mix of, I can do some teaching and lecturing, and I can, do host rounds and work with residents, especially now with Zoom. I can work with dermatology residents all over, and even work with pathologists, and I can get second opinions, and, we can share cases and stuff. And it's a lot of fun. So I like this now because it gives me the most flexibility. Because I know in some settings, I don't know if this is still the case, but I was told there's like a benchmark you're expected to achieve daily. And I was like, I can't do
Yeah.
that. And so doing the contract work was a bit challenging, because you only get paid like $10 to $12 a case. And it's really hard to make a living. Here you are, board certified, now almost, 10 years out of residency. And it's like, I couldn't even make enough to pay my babysitter $15 an hour. So I was like, something's got to give.
Yep.
So, I just got to go out there and start visiting clinics and introducing myself and join the local KCBMA. And, they've been very welcoming and supportive. And,
And how long is that? So when
I've
did you start?
spoken there.
When did this all start?
I I officially started the business in 2015 when
Okay.
Abaxis closed. And so I started it as a subcontracting, and I had some of the consulting work, and I did it through that business. But then I just slowly started to build up some of my own clients while doing the other work. Um, and so then once I started to feel like I had my footing, then I started stepping back from working from others and more for myself.
That's so exciting. And so it's innovative vet path, right? Yeah. And you just do derm, or do you do lots of stuff?
I I I read a few cytologies because that's something I learned to do when I was working for Florida Vet Path. Anita Keel is a fabulous mentor, a phenomenal pathologist, and just an amazing lady. And she was a big inspiration and mentor for me, how to run a business. She and her business partner started, and she is trained as a clinical pathologist. Her partner anatomic pathologist who specialized in derm path, had a special interest in derm path. The two of them teamed up together and started their business, and they've been running like over 30 years. And um, now Anita is running it. But she learned to read both biopsies and cytologies. And she said, Karen, it will make you a better pathologist if you can read both. And we had like a little bit of exposure to cytology during my anatomic path residency, but I was not confident. So when I started, it was pretty rough.
Yeah.
And I was like
It's
texting
different,
her.
much different. I mean,
It
they're
was like
complementary, but they're definitely different.
it was like being a resident all over again. So I was like, texting her pictures and like going back and forth. And she really held my hand and taught me a lot.
Nice.
And I do think she's completely right though, because I think being able to see the cytology and read the report and think, okay, what was going through the clinical pathologist's mind? What should I be looking for? How can I support that or add to that? It because it is like it all fits together. Everyone's on the same team. And so it just helped me think of things, just like I liked to make the correlation between like, how did this animal or this lesion look clinically? What else was going on with that lab work? Is there something that maybe I should be asking or making sure the clinician asks or tests for before I make a final interpretation, or something else I should add to my list? And then adding in like a bit of cytology just added so much. I mean, I'm definitely out of my depth with a lot of things on cytology, but some of like the routine
Mhm.
stuff I think was helpful. And so I read a couple, but it's not my strong suit. I really, if I could read Derm Path all day, every day, that's what I would love to do.
But so the things that people submit to you are histopaths, and
Histopath,
you're doing, I mean, except for a smattering of cytologies here and there, but you're
like
doing,
1%.
but most of what you do as an anatomic pathologist for those watching is histopath. And so people are
Yeah,
submitting tissue biopsies,
yeah.
histopath biopsies for that word. We know that word biopsy in the path world. I'm like thinking of how to say it because anyway, we won't get into that. But the focus and is the focus of your business dermatopathology specifically? So will you read other things, or is it just like,
Uh,
so if people wanted to submit things to you, they would submit anything associated with the skin?
Usually, yeah, like skin masses, inflammatory lesions, because sometimes you don't know if it's like an epitheliotropic lymphoma or not. But anything skin, anything from the skin, I'll read. I have worked with internists and stuff before and read, livers and a lot of GIs. But um, while some of them are very interesting, it's not my true love. So it's sort of been an evolution, and talking with other pathologists that did venture out on their own and start their own practice. I talked with a ton of pathologists and people that have either small groups or solo practices. And there's pathologists that specialize just in ocular pathology. And there's a phenomenal pathologist. She specializes in just like oromaxillary, like dental pathology. And so I talked to a lot of different people that do that. And they're like, oh yeah, subspecializing is so much fun.
Yeah,
And
and
I was
there's
like,
a need for it
heck
because they're challenging areas. Skin can be very challenging, and it's not that the kind of general pathologist, for lack of a better term, because that's what I would consider myself as well. But it's not that we can't do that area, but when you have that extra like focus on that, it can be really valuable to the practitioner because I see people ask a lot, like, does anybody know a dermatopathologist specifically? Because I have a really challenging case that I really want to make sure somebody that looks at this all the time is looking at. So, I think it's great. And you've had, I mean, obviously had success with it. So it's been around for several
yeah.
years.
I've gone to different conferences and workshops to learn more about DermPath and done, CE and tried to work with other people and also working with the dermatologists, getting their feedback has been really helpful. But like I am not comfortable with neuropath. Like I would recommend probably someone else for that or
Neuro
you
is a
know
whole nother
or
world. Cytology too. I'm like, oh, is it a meningioma? I don't know. Why did they can look so they can look so many different ways.
I don't
Yeah.
think I can even remember all the different subtypes. Like I
Yeah.
have to look that up. Like that's not my
No,
jam.
no.
So,
Well,
but I
I love that. I love that you've picked an area that you are good at and that you love. I mean, that's the like best thing at the end of the day to be able to do something that you enjoy doing every day and you get to do and you teach in your Facebook group and you start doing rounds and from a fellow online teacher, like I love it. But
awesome.
yeah.
And I'm inspired in part by you. I was like, oh my gosh, look at what she's doing. This is amazing.
Well,
And
that
I was just like, wow. And you're so great at that. And I love when you label everything because I remember being in school and they would just be like, oh yeah, and like this over here, there's all of this pattern going on. And I'm like, what? What? I don't know what's going on. And you
yeah.
actually specifically label like here's the cell and the nucleus, and this is why it's this, and it could be this or this, but here's why it's not.
Yeah.
And that's what I think you have like a natural gift for that teaching and making things approachable and relatable and not intimidating. Because I feel like nothing drives me nuts more than when like someone is teaching something and they just like gloss over it and you're
Yeah.
like, I have no
Yeah.
idea what just happened,
Well, and you have to
what
get
I'm supposed to learn from this.
yeah, just the getting out of your own head, and
Yeah,
visualizing how other people are receiving the information you're giving. I mean, I know a lot of big words, you know a lot of big words, and it's not at all about dumbing things down. It's just it's speaking a common language, and our language tends to be a little different. And so if you're just talking in your own language to people who aren't as familiar with that, then you're doing nothing. They're not understanding. And our career is such that I think there's a lot of, I mean, obviously imposter syndrome and stuff. And so people are just uncomfortable saying when they don't know what you're talking about. And, you know, I think I've had excellent mentors myself. So I appreciate you so much saying that. But that's where it comes from. Ann Barger at Illinois is my residency mentor, and she's an incredible teacher. So that was, she's my inspiration if she's watching. But yeah, I mean, I love it. It's so fun, and it's so fun to share the interesting world of path with people and show them it's not all just boring and drab, and it can be very not only helpful but fun and interesting to
yeah,
see.
absolutely.
Yeah, so
I
I love
think
that we're both
you've
doing
really,
the same thing.
yeah, and I feel like you really made pathology come alive and brought color and personality to it. And you
Well, I
know,
love that we're doing it together because I think that I mean, just having more people come out of our proverbial basement and say, hey, we're like normal people too, and this is fun, and there's a lot to learn here. And yeah, I mean, just I'm fine with that. If that's what I'm doing, just by getting excited about what we do, then that's cool with me. So I love that we're both in that same headspace because it's very fulfilling. But
yes, yes,
Well, this has been so fun. I'm so glad to have actually like gotten to talk to you, and maybe next, ACVP that we can actually attend.
Yeah.
We can meet in real life, but I mean, I think this year it's going to be like the digital and in person, but I'm not sure if I'll be able to make it up or not. We both have young kids, so it's kind of hit or miss, but just congrats on everything in your business. And that's a huge feat, just living a fulfilling life in the job that you just feel good about and that you made yourself is just something that's so much to be proud of. And but yeah, I really appreciate you coming on here and talking, because everybody is gonna love hearing this experience, because it's just, knowing where you started and where you're at now and how much more there is to do is just like so helpful. So thank you. Thank you. Thank you. And yeah, I think that we'll just wrap it up, because we're a little over an hour, which is fine. I could talk for a lot longer. but yeah, thank you for coming on. My dog
Yeah,
just
thank
barked.
you so much. Yeah, pleasure meeting you.